What's important when you use the proximal humerus is that you place the arm across the abdomen. This is important so that the humeral head is rotated inward and we have the tubercle on the outside. The next thing we want to do is palpate very deeply to the shaft of the humerus. You can feel it very carefully, and as you go up the arm, all of a sudden you will feel the surgical neck, or where the head of the humerus attaches to the shaft. It feels like a golf ball on a golf tee, and you can feel it very easily right there. That's the surgical neck. Your thumb fits into it very nicely. As your thumb fits into that spot, you know you're in the right position, and so our target area is 1 centimeter above the thumb, right there, and that's where we go in perpendicular to the skin. If you do that, you'll never miss. And there's the ball. Your thumb just fits right in there. So when it does fit in there, that is the target spot right there. Right above your nail, 1 finger breadth at the most. So we come in right here. This is the target area, and we're going to drill in. There are 2 other precautions with the humerus. One is, after you do insert it, you do not want to lift the arm, because if you do, as the arm comes up, the easy IO impinges on the acromion and pops right out. The second is that you should always use the LD needle, the longer needle, because you need that extra length to go into the humerus far enough so that it won't come off, and so it will be stable. So you need to use the yellow LD needle. You should prep the area before you start in any manner that your institution dictates. In this case, we're going to use some alcohol around the target area, and I'm going to connect it to the driver. It connects with a magnet, it snaps in place, has a cover on it. Just hold onto the cover, spin it, and it'll come off, and now we're ready. At this point, again, I want to make certain I have found the surgical. You ready, Yvonne?
I'm ready.
Okay, we're going to go right in here, and here he goes. 1, 2, 3.
Oh, not at all.
What was the pain on a scale of 1 to 10?
Maybe a 2 or a 3.
2 or 3. Okay.
I've had IVs that hurt worse than that.
Right, we take out the stylet. What we want to do before we infuse anything in an awake patient through the humerus or through any IO site is to give lidocaine. This is preservative-free lidocaine, 20 milligrams per cc. So I'm going to give her 2 cc's, but not all at once, because if I gave her 2 cc's, the second would just go through the body. So I'm going to give her the first cc slowly. I'm going to wait for it to take effect. It doesn't take as long as people think. Often just 15 to 20 seconds is plenty of time for it to take maximum effect. So I'm going to put the second cc in now, Yvonne, and see how you feel. I'm going to push you fairly fast. How was that?
Barely, you could
Good.
barely feel it.
Okay. At this point, we're going to flush. Remember, no flush, no flow. You always have to flush to get good flow, because inside of the medullary space is this fibrin, thick marrow, and you have to flush it out of the way before you get a good flow. Are you ready?
I'm ready.
Hang on, I'm going to flush fairly hard. Ready? 1, 2, 3, 4. What was that?
Probably about a 3, maybe a 3 or a 4. It just.
Okay. We got an excellent flush, as you saw, and now we'll connect it to an IV and see what kind of flow rate we get. We're going to need about 300 millimeters of pressure to get a good flow rate. The higher the pressure, the higher the flow. There it's in the green bar at 300. You can see a tremendous flow rate. Now we attach our syringe. It's important not to rock it back and forth. If we rock it back and forth, it could break off the hub. So we want to twist clockwise, turn it clockwise, pull straight out as you turn. And you can pull out and turn, and it should just come right out for you. And now what you do is place a little pressure for about a minute and place a Band-Aid over the area. How does it feel now?
Normal.
Normal.